morning. We'll begin with the first session for the day very shortly. All of you are requested to please take your seats. कुछ ही देर में हम आज के अपने पहले सेशन की शुरुआत करेंगे. आपसे अनुरोध है कि आप अपना अपना स्थान ग्रहण कर लें.
Check. All right, ladies and gentlemen, would like to request you all to please get settled down as we are about to begin with our very first panel discussion. I request each one of you to please get settled down. Thank you so much. देवी और सज्जनों, आप सभी से निवेदन करना चाहूंगी कि आप सभी लोग अपना अपना स्थान ग्रहण कर लें. हम कुछ ही देर में हमारे सबसे पहले पैनल डिस्कशन की शुरुआत करने जा रहे हैं. आप सभी से निवेदन है कि आप सभी लोग अपना अपना स्थान ग्रहण कर लें. धन्यवाद. Once again, I request all the people in this hall, I would like to request you all to please be seated and get settled down as we are about to begin with our very first panel discussion. यहाँ उपस्थित सभी अतिथिगण से मैं निवेदन करना चाहूंगी कि आप सभी लोग अपना अपना स्थान ग्रहण कर लें. कार्यक्रम की शुरुआत करते हुए हम हमारे सबसे पहले पैनल डिस्कशन की शुरुआत करने जा रहे हैं. धन्यवाद.
Good morning, ladies and gentlemen. It's a bright and sunny morning today. And inside this hall also we have some bright faces. So I welcome you all to day 2 of this conference. Day 1 highlighted the promise of innovation. Today is about shaping its purpose. Day 2 invites us to ask how technology can deliver equity, access, and outcomes at scale. On that note, let us begin with the first panel discussion for the day. The moderator for the session is Dr. Pinky Joel, IAS, Secretary Medical Health and Family Welfare and MD NHM UP. Ma'am, please come up on the stage and deliver your opening address.
Good morning all. So, I welcome on behalf of State of UP and NHM all the dignitaries here and fellow colleagues and officers from other states. This conference is very important for starting the future of health with respect to AI. So this is the second day. I think hopefully yesterday we had the exact context setting and how we are going to go ahead with respect to AI. This plenary session is about leveraging AI tools to strengthen India's healthcare, empowering human resources for health, scaling of telemedicine and remote care. This session explores how AI-driven tools can strengthen India's healthcare delivery by empowering the frontline workforce. They are the real stakeholders to bring the best to the last mile person, even in the remotest area, about the health professionals, ASHA, Anganwadi, ANMs, chief health officers, the recently added workforce for the Ayushman Arogya Mandir at the population of 5,000 across UP, across India. While scaling up of medicine, telemedicine, and remote care to the underserved population, especially because we are talking of universal health for all, it focuses on practical, field tested use cases and the system enablers needed for a responsible, inclusive, and a scalable AI adoption across community and the facility based care. So we have our speakers with us. Apart from that, I would just say कि we just were thinking how AI can truly empower the last mile health worker. This is the basic core agenda of today's discussion. We have in Uttar Pradesh Ashas approximately 1,80,000 Asha and Asha Sanginis, ANMs. In the Women and Child Development Department, we have Anganwadi workers, nurses, medical officers. They form the backbone of our health system. AI tools they must align with their workflows, languages, and the realistic problems. We are trying to find out the practical solutions going to the level of their understanding and a knowledge level of an ASHA, ANM, and any field level worker of any department, because interdepartmental coordination is the key for the holistic health outcome. Whether it is a PRI, it is rural development department, urban development department, women and child healthcare department, including the agriculture department. So interdepartmental coordination and health of all, the solutions must be intuitive, low burden and supportive, so that reducing paperwork, improving the decision support and freeing time for patient care. If technology adds friction, you know, there was a time when computers had been introduced in India and there was a lots of hue and cry that people will lose jobs. Same is for the AI. Now there are lots of YouTube channels. They say ki only who all are going to be relevant in AI. They give two, three examples only, and the rest of the people are in little confusion. Secondly, it is very difficult and complex system. So if it creates a friction rather than a value, it will not sustain. Equally important with that is the data security and ethical responsibility who is dealing with it, because there are lots of challenges coming recently. The government of India has announced a policy. They are telling they're going to make a policy for the security and health being a subject where 50% of our population is of women. The security and safety of our women and the children is very important and is of utmost sanctity has to be given to that. Health data, it is very personal when we're talking of Abha ID. So, as AI systems aggregate and they analyze sensitive information, strong safeguards are essential. Secure data storage, consent-based usages, transparency, and a clear accountability. Trust is a foundation of public health. We say, कि ना, if you're going to a doctor or a lawyer, you have to tell everything truthfully. You should not hide anything. So the trust is the core of a health system. Without trust, even the most advanced tools will fail. So we should have a trust. Along with that, we should have proper data security systems. Government leadership therefore becomes more critical. AI adoption can't rely only on isolated pilots. It requires a policy clarity, interoperable platforms, workforce capacity building, and the strong public private collaboration. Ultimately, we need to see where we can use AI for the basic things to make them better. Identify, for example, if we are working on maternal mortality rate and IMR and all, identifying everything at the earliest possible phase and the stage, strengthening the referrals, detecting the disease trend covers sooner, and support the health workers at the point of care. When AI becomes an invisible enabler rather than a visible burden, it truly serves the public. And health, being the public most important public sector, so that's how it shows its importance. With this perspective, I look forward to a thoughtful discussions focused on a practical use cases, system enablers, and a responsible implementation. I would like the officer, Dr. Milind, to call upon all the concerned panelists and invite them so that we can start the session. Thank you.
Thank you, ma'am. So we have a power-packed panel for this session. It's my pleasure to invite Shri Arvind Kumar, Director General, Software Technology Parks of India. Professor R.K. Singh, Head of Department, Telemedicine, Digital Health and Emergency Medicine, SGPGIMS, Lucknow. Dr. Sanjay Sood, Project Director, E-Sanjeevani, CDAC, Mohali. Professor Sriram Ganpati, Associate Professor, Department of Electrical Engineering, Indian Institute of Sciences, Bangalore. Colonel Samir Kanwar, Director General, Health and AI, PATH. And Dr. Sujoy Kar, Chief Medical Information Officer and Vice President, Apollo Hospitals, Telehealth. Welcome to all the delegates. The keynote speaker for this session is Dr. Pinky Joel. I invite Dr. Pinky Joel to please deliver the keynote address.
A very good morning to all, respected dignitaries, distinguished panelists, colleagues, and friends. As we all know, the leveraging AI tools to strengthen India's healthcare, empowering human resource for health, and scaling telemedicine and remote care. In this context, if we look at that India stands today at a critical juncture in its public health journey. On one hand, we have expanded the reach of healthcare to the level where they were once unimaginable through primary health centers, community health workers, free ambulance services, and a large-scale national programs. On the other hand, there is a demand placed on our health systems are growing faster than our capacity to respond through conventional methods. This session asks a fundamental question: can artificial intelligence help us strengthen our healthcare systems, not by replacing humans, quote unquote, not by replacing humans, but empowering them? The current situation, if we see, there is a high burden, high aspirations, and high variability. Our frontline workforce, doctors, nurses, ANMs, CHOs, ASHAs, Anganwadis, they all remain the backbone of the service delivery. Yet they are often overburdened with documentation, referrals, reporting requirements, and decision making. Overburdened with all these things, the decision making becomes little uncertain Though we have tried few aspects like telemedicine, which has expanded access, especially the post-pandemic, but its penetration, its quality, and integration into the routine care remains still uneven. AI has already entered into the system in diagnostics, radiology, triage tools, disease surveillance, and teleconsultation platforms, but largely in the pilot modes, in a fragmented deployments, and urban or a tertiary care setting, which is very limited. So there are lots of differences, there are lots of challenges, especially in interstate and intrastate inequalities are existing because of the digital readinesses. Equally important are intrastate inequalities between districts, blocks, urban slums, remote tribal areas, and aspirational districts. The same AI tool that works seamlessly in a medical college may be unusable for a frontline worker in a low bandwidth, low literacy setting. Therefore, AI risks amplifying inequities unless it is consciously designed to reduce them. So the next question arises to our mind: is AI the solution to all our problems? According to me, it's my personal understanding that it's no. AI is not a silver bullet. It can't compensate the weak governance or any poor infrastructure or any inadequate financing. It cannot replace empathy. Again, quote in quote, this is the core of a health system, public health system, ethical judgments where we face day-to-day issues or on human accountability. But what AI can do is optimize decision making, reduce cognitive load, improve early detection, and extends expert support to the last mile if it is used wisely. The danger lies not in using AI, but it is overestimating it. So we need to have human understanding along with that. So the future challenges which we think we have to look forward from the past experiences, since the new disease patterns are rising, like non-communicable diseases, this will be dominating the morbidity and the mortality in the future. Cancer will demand early detection and continuum of care. An aging population, which is approximately, as per the latest data, is approximately 36% of our population will be aging in 2030, will strain long-term care systems, mental health issues. It's going to rise, fueled by the social isolation and the economic stress because of the fragmented families, increased screen time on the phones and on laptops, sedentary lifestyles. These are going to redefine the risk-based patterns of the health in the future. So we need to use AI in this context. These challenges require a longitudinal data, predictive analytics, and integrated care pathways. Areas where AI can provide meaningful support, but only when it is embedded with a strong public health system. So we cannot replace a strong public health system with the AI. Just it can be complementary to each other. Are we really ready to use AI in healthcare with respect to India, as well as can be the future forerunners for others? Yes, definitely there is a positive note. We have a vast digital public infrastructure, large health databases, especially with respect to UP. I will say that we have a beautiful systems of data collection using an e-coverage, which is the biggest in India. The huge data with us on different aspects. And the ABHA ID's basic enumeration has been done based using this only, and we have covered almost 20 crore plus enumerated population with us. Approximately 14 crore ABHA IDs created with that. So that we have a large database, a strong technology ecosystem is growing, and a growing policy clarity. But we'll need again the data quality and interoperability and capacity building of our health workers. Trust and explainability is an issue because people are still thinking trust has to be created based on that and clear accountability. So the unforeseen problems with respect to the field workers and other things working in the health department, which we have felt is that data privacy is an issue and security breaches could be there. Algorithm bias is especially against marginalized population. Yesterday, my batchmate, Secretary Health of Bihar, was telling if there is a wrong input in the data, so it's going to give us a very wrong decision making in an altogether different trajectory. Over reliance on an automated recommendations, the skilling of health workers if systems are poorly designed, the absence of human oversight, it can turn AI from an asset to a liability. So this is a core thing which we need to see. So we can use it as a servant, not as a master. We should use it very judiciously because health is very personal in a very private sector. Or dealing with the individual dignity, actually, if we have to see, it's not the road or any other sector. In health, the dignity of an individual human being is at stake if it is going in a wrong direction. So this brings me to the central principle. I think we can just think of AI must remain as a servant, not a master, an enabler, not a replacement, a decision-making support tool, and not a decision maker. The goal is not to reduce human presence in healthcare, but to free human capacity for what matters the most. That is what is clinical judgment, compassion, and community engagement. If AI helps my ASHAs and CHOs and ANMs to identify the risks earlier at their doorsteps and help a doctor to try it better, or a health system allocates the resources more efficiently and equitably than it has served its purpose, it is going to serve purpose for us. The real question before us would not whether we should use AI in the healthcare or not, because we can't miss the bus. This is the future. So sooner we learn, better it is for us and for our country. With having such a huge workforce, intelligent, skilled workforce, we can be the next leader in the AI in globally. And the example is it's already set. India is hosting the next global meet in February. So it is an insignia of, or it's an acceptance that we are going to be the true leaders in the world in future. But importance is but how responsibly, how equitably, and how humanely we chose to do it. This panel will bring, I wish and I hope this panel will bring together the policy leaders, technologists, clinicians, and implementers, and I look forward for a candid discussion that, that will lead to move forward from pilots to platforms, scalable platforms, and from innovations to the impact. I still remember there is the future of AI could be. I don't know how many of you have watched the Robo movie of Rajnikant from Tamil Nadu. Have you watched it? Nobody. Okay. So what happens at the end? The robber Rajnikant, he falls in love with Aishwarya. Huh? So how can a machine fall in love? So that is the future of AI. That is the empathy. If we could create an empathetic robot, that will be an asset to the health system, the public health system of India, across India, as well as if we could research and develop that kind of a thing, then definitely that will be a real utilization of AI for the larger interest of the humanity across the world. Thank you all.
Thank you, ma'am. You raised some very relevant questions. Now I request Dr. Pinky Jewel to please steer the session ahead. Ma'am.
Uttar Pradesh, welcome to all your panelists. So my first question goes to Professor Arthur Pinky, the head of the Department of Telemedicine and Digital Health and Emergency Medicine at the PG of Lucknow, Senior Institute for Pradesh and University for Pharmacology. So we would want to know from you that, from your perspective, what are the most critical gaps in India's healthcare today that AI can uniquely fulfill for us?
Thank you, ma'am, for the kind keynote address that you gave, and you reminded us about the robo. Um, I congratulate the Uttar Pradesh government and the Department of Medical Health and Medical Education for organizing this sensitizing platform for AI in health innovation and conference. So my two words at the start would be AI is not magic, AI is not evil, AI will not take away your jobs, but people who know AI will take away your jobs. So the first thing is know about AI. Ride this horse, don't be afraid of this horse. With that context, I would put it, there is a lot of scientific basis behind what we are doing. Humans have created it. We must master it. We must not be afraid of it. It will not take away your jobs. Again, I tell you, people who know AI will take away your jobs. Not AI itself will take away your jobs. So learn AI, be knowledgeable about it, no hype, not magic, not in evil. Now, coming to ma'am's question as to what are the critical areas in which AI can help us. So there are a huge number of areas. If I keep counting, there could be around 20 or 30 areas in healthcare where AI could help. I believe in the audience, how many of you are doctors? Can you just raise your hands? Okay, so a lot of my fraternity is there. So I will talk in terms of what AI can do for you. So there is doctor-patient shortage. This is the maximum area where things are going to work. Doctors are less in number. The WHO says the ratio has to be for 1,000 people, one. But go to rural India, this ratio will be 6,000 patients to one doctor. So AI can help you bridge this gap. So doctor-patient ratio, yes, AI can help you. Second is specialist shortage. We have CHCs, we have PHCs, we have the district hospitals, we have medical colleges, surgeon shortage, neurologist shortage, cardiologist shortage, physician shortage, ICU intensivist shortage, radiologist shortage, pathologist shortage. Can AI help me? Yes, AI can help in leveraging technology to bridge the gap between what is desired from a radiologist. The AI can help you bridge this element. So this is second element. Third, madam pointed out about the diagnostic delays that are happening. So diagnostic delays are primarily happening because these trained people are not there at the point. So a CT reporting time may be from 1 day to 3 days. An MRI reporting time may be from 2 days to 5 days, even in the best of centers. AI can do this in 1 minute to 3 minutes, from a normal CT to an abnormal CT. So radiologist is not there, AI can help you sort it out. But AI will not diagnose the entire spectrum of abnormalities. You need the human in the loop to make sure that things are done in the right way. So this is another element. Pathologist is not there. You have a slide. So AI enabled whole slide imaging analytics. They are very, very good in diagnosing. The field of vision, computer vision has evolved massively. So what my eye see or what a trained radiologist eye sees, an AI enabled vision analyzer can see 1,000 times better. 1,000 times better. And therefore in diagnostics, you see AI is rocketing. Majority diagnostic areas, AI is rocketing because computer vision has got machine learning, it has got deep learning, and even further generative learning. So a lot of advancements you see in radiology segment is coming. So we can take advantage of these segments to bridge the time of delay that is happening in MRI diagnosis, CT diagnosis, X-ray diagnosis, ultrasound diagnosis. So huge area where diagnostic delays can be reduced. Madam pointed out about the non-communicable disease. Almost 70% of deaths in India may be contributed by non-communicable disease. Diabetes, 15% Indians. Hypertensive, nearly 20%, 25% Indians are hypertensive. Cardiovascular disease. There are huge lot of burden in the non-communicable disease. So can I risk stratify? There are less number of doctors, more number of patients. So can AI help me risk stratify them? Can identify them? So AI will help me in risk stratifying, and I will know from thousands of patients that these 100 patients are at the highest risk. So AI can help me identify those highest risk diabetics, highest risk hypertensive, highest risk stroke patients, highest risk coronary artery disease patients. So AI can help you there in identifying these high risk patients from amongst all those patients. So it helps you. Mental illness, madam pointed out, The ratio for psychiatrists per 1 lakh population is 3 as per WHO. What is the ratio in India? 0.75. So there are only 0.75 psychiatrists per 1 lakh Indians. So how are you going to meet this challenge of shortage of psychiatrists? Mental illness is rising. So telemanas, tele-AI, tele-psychiatry, impregnated with AI. So the smartphone that the person has, when you talk to it, when you take an image, your behavioral patterns, they can all be recognized. Even a diagnosis can be made. A prescription can be automated. It can be then connected to a trained psychiatrist who can guide you through the stream. You can follow it up. So your smartphone is doing everything for you. Almost most Indians have smartphone, if I'm not wrong. Most Indians. So there is technology at hand. You need to have edge computing into this, that is diagnostic elements into this within the app. So even if the internet is not available at a particular site, the app itself can help you sort out, can triage, can do all this thing. And then when the syncing happens, when the internet facility is available, you can consult a psychiatrist at a higher center or a tele center at a higher center. So these are ways it can help you. ED overcrowding, emergencies are overcrowded, less nurses, less doctors, huge number of patients. Somebody in the queue, the 100th patient is having an MI, the upfront nurses or the doctors don't know that this 100th patient is having an MI while he's waiting for to be seen. So how can AI help you sort this mess out? So it can help you triage, it can help you identify. So the CCTVs and the cameras itself can help you identify patients. This is a sicker patient. They can analyze your facial behavior. They can analyze your pain. They can, just like you go to an airport, a narcotic, somebody carrying a narcotic has behavioral patterns. So similarly, in an ED, if you have, you can identify patients who are more in distress. They can be sorted out. They can be pulled up from the queue and brought up front. So these are all technologies that are happening, and AI definitely can help. Madam talked of maternal and child health. Preemptive counseling, preemptive detection of eclampsia by AI-enabled, ASHA worker-enabled apps, which are who are going to a female. They can analyze the blood pressure, they can analyze the scoring systems, they can consult a gynecologist. The detection rate is, you can identify preeclampsia at 15th week. It is so early. So a lot of things are happening. I think in West Bengal, Brahmi app, if I'm not wrong, these are helping. In Kerala, they have apps for this. So they have empowered their ASHA workers to do all this work. So that you can pick up these earlier and help reduce the maternal mortality. If compared it to Kerala, the maternal mortality in UP, yes, we need to be below 100 at least without target. If you compare it to Kerala, we are way, way behind. So the best is Kerala. So how are you going to bridge this gap? So bring in the AI technology, enable your ASHA workers to bring these patients earlier, have institutional delivery. All these things are important for reduction of maternal mortality. Prime Minister, Honorable Prime Minister just talked about antimicrobial resistance. How are you going to reduce antimicrobial resistance with AI enablement? Yes, you can do it. All your labs, you know the disease patterns that are happening in a particular clinic, in a particular hospital, the microbiology, all that is enabled on a digital. So you may know where the disease outbreaks are happening, what is the disease antimicrobial approach to it. You can have an assimilative package to understand the antimicrobial resistance, and you can act preemptively to reduce this. Okay, because this is going to be a huge and massive problem in the years to come. Other elements, we are having siloed EHR. Our EHRs are not connected. First, they are not there. So PSCs don't have EHRs, CHCs don't have, district hospitals don't have, medical colleges don't have. There's probably some institutes which have got EHRs. These EHRs are again not Abha, and
Even the EHR business is just 30% is digitized, 70% is still on paper. Unless the EHRs are fully digitized and we are going onto the computers for entering of all this data, it will be a huge task for AI to review this. So there is a huge amount of task to be done. One more element I will touch, drug supply chain. AI can help. Material management. Remember, in any hospital and any unit, you have more number of equipment than the staff is having. This, the equipment is sick, we don't know when was it bought, what was the warranty period expired, what was the CMC, how many times it has been serviced. So there are AI platforms for material management which will send out alert that this device is faulty, it needs to be repaired in a correct time. So this is AI enabled material management which is coming offline. All the medical colleges and the district hospitals, how to better the material management aspect. So this is a huge area where AI can help you. I think I enumerated a lot of areas.
Yes, sir. Definitely. So, considering from your point of view and topic, the session that you have given for Marji, Director General, Software Engineering Parks of India. Sir, I take so how can this IAS contribution to improving public university and achieving Bharat
Good morning. It's really very privileged to be part of this very interesting gathering. When the event is organized by UP government, it always gets us feel it's a very high scale event. Uh, in fact, we see today AI. Uh, we look AI as a uh, third big revolution in the history. First revolution, we always say it is in terms of electricity. If electricity could not have been invented, whatever development happened in 100 years, it could have happened in the 500. Electricity has increased so many things, improved the quality of life, productivity. So second revolution came in terms of invented. It could have taken around 50 years, which has happened in last 10 years. Third is AI. This internet has done more on information asymmetry, furthermore on financial sector. If you look last 5 to 7 years, I think we have done big revolution in the financial sector, either in terms of ESPN or in terms of UPI. Now, third revolution, which is coming in the form of AI, it covers entirely different sectors, and those sectors which has not been done by either power or by electricity. It is going to touch those sectors like maybe for assistive technology, maybe for health, because every new technology comes, it increases some efficiency of the humankind, quality of life, and some efficiency like when the internet, mobile came, it has increases uh, anatomy of my palm. Now your hand is not a fitness. Now this AI will increase capability of existing doctors, paramedical courses, machines which are used for diagnosis and all. Today, there's a lot of gap when it comes to healthcare sector in terms of demand and supply. I think AI is well fitted uh, for, for fulfilling this kind of the gap. In India, we are producing 1.8 lakhs doctors per year. But as per one of the report of WHO, it says that we need maybe 24 lakhs more doctors by 2030. This gap, I think AI is well suited. Only problem with AI is, as of now, is that in India we don't have much structured, systematic data of medical reports, health system, and this data has to be structured and should be made available at earliest possible. And I think Ayushman Bharat is doing a lot of things in this direction. The only thing people have to understand is data, how the Ayushman Bharat or any entity which is storing it, how it is anonymized, and how it can be better use of future of our generation and for themselves also, instead of looking at only that privacy concern, that concern, just look into the privacy concern. But that data has to be shared because we are looking like uh, when we created digital public infrastructure, it has become an example for the world. Similarly, today we need uh, an inclusive, intelligent, and Indian-led healthcare system. And it could become only Indian-led healthcare system if we have the Indian data. And India has a very specific problem. India and corresponding some developing countries. And this all the AI must understand that all the AI tools should be trained by Indian data. If they are trained by Western data, it will give a entirely wrong results to us. And therefore, our startups, everybody should work that how to collect our data, how to process it at the earliest possible. Once all AI tools are available, which is trained by Western countries or any other country, this all results will be solutions should be lie in ourselves. We have a lot of capability. We have developed a lot of capability in AI. Government of India, including Uttar Pradesh government, we are having a lot of schemes, lot of facilities with AI. AI mission is already supporting. Is the budget of more than 10,000 crore, which is supporting all types of the AI, whether it is a vertical integration, whether it is a wrappers, whether it is infrastructure. Government of India is providing GPU support. These such support should be extended by all state government. I think with these supports, the new AI system, new AI trained tool, new LLM which is trained in the country, we can create a very world class AI tools by the way. Thank you.
CCTV, so the doctors can easily pick the medications from the suggestions which show up through AI for the doctors. And we are finally making an attempt to also help doctors by providing them generative AI or by using NLM or generative AI, wherein when the doctor speaks with the patient, understands the ailment, AI would on its own create the whole prescription out of the dialogue that happens between the doctor and the patient. So these kind of interventions can not only empower frontline health workers, but
also aid quicker decision making on the doctor's end.
for the doctor. Ask relevant questions, see the patient, and enter the whole data into it and then prescribe it. And sometimes there is an issue when what doctors write when they from the chemist can read it. So I think it can thanks a lot, Ji. And the I take opportunity to request Professor Sriram Gandhi. Professor Department of Engineering, Indian Institute of Science, Bangalore. How can AI be leveraged for continuous medical education, clinical decision support, and skill upgradation of the healthcare workforce? Means the medical education is the core because we need doctors, we need specialists, we need super specialists, we need trained paramedical staff. So how it can transform our medical education system actually? So we would like to
Good morning, everyone. Thank you for having me here, Dr. Pinky, and the whole set of organizers behind this successful UPAI and Health Conference. So I also would like a short introduction to say that I also co-lead the AI Center of Excellence in Health, recently awarded by the Government of India Ministry of Education and Health coming together. We are co-located at the Indian Institute of Science, and we call ourselves TANU, which stands for Translational AI for Network Universal Healthcare. So before I go directly to answer the question, so I want to follow the lead that Professor R.K. Singh did. I also want to ask the audience, how many of you are engineers here? Raise of hands. Software professionals. Yes, I see some of you. Any deep tech startup professionals here? Yes, we see some of them. And policymakers. Quite a bit of policymakers that are still shy to raise their hands. So what I wanted to say or bring to this point is that AI for health primarily is a highly interdisciplinary area where lots of these people have to come together, come from policy makers, from medical professionals, software engineers, AI developers, engineers, and then all the way to social health workers, and last but not least, patients who are really the consumers of these products. So this real multidisciplinary conglomeration has to come together for making any of these AI solutions to bear for what the promises they provide. So coming to the question that ma'am had raised in terms of medical education and education in general. So there has been a thought even at our university, like the Institute of Science, that pretty much anybody coming in, even for the bachelor's program, should go through an introduction to AI. So this basically introduces at least the bare concepts of what AI can do, what AI can't do, and where essentially the current state of things are. And of course, it's a very evolving field which requires solutions every 2 months or years. But an AI curriculum, at least a basic AI introduction program, could be one of the first starting points in curriculum of various studies, just like we introduce undergraduate mathematics or physics, chemistry, and so forth in medical education sector. So in addition to that, like, particularly when it comes to AI for medical healthcare settings, I would also suggest having courses and topics related to regulation, to data protection, privacy, to safety, to understanding, let us say, the limitations of AI, to know when they hallucinate, when they start providing results that are too fluent to be thought of as unreal or thought of as fake. That many of the current AI models, I also draw from my own experience in Google DeepMind, where we're working towards building models like Gemini. Models that you see out there are extremely tuned to fluency. They care about being very nicely sounding, but hiding the lack of substance, hiding the lack of ability to be factual. So, so models are optimized for fluency. Models are optimized to predict the next word or next patch in your image and so forth. So this optimization automatically means that everything that comes out of the is trying to look nice. So now when you start using them for various use cases that are not their domain, not their cup of tea, not the area, the data that was used to train them, they are going to misbehave. And many times they hide them in the plain sight, which means that it is hard to figure out when models are missing some things. So knowing these guardrails, knowing, understanding where the limitations are, I would strongly encourage the policymakers to think about medical education, understanding limitations of AI along with the hype that AI comes with. So coming to, let's say, the other question that ma'am asked, like, if you look at where AI can make an impact, my thoughts once again on this is a layered introduction, figuring out the focus where AI can change. There are lots of things that many of my panelists mentioned. I also agree with most of them, if not all of them, on the AI impact. But knowing exactly the focus where AI can make an impact, trying to introduce them in those layers in a human in the loop along with the AI, so that the AI is not completely autonomous. It's more like a co-pilot than an autopilot. So these are, let us say, situations where AI can make an inroad in the system. So while we made a lot of hype to the journals and studies, not only from India but from the West even, to look at AI funding in healthcare, and if you ask these publications, they say that it's almost remained flat. The reason being, while AI has produced lots of innovations in the last year, AI for healthcare has not taken that, primarily because the lack of focus, primarily because the lack of uncertainty and calibration in this, and also the bar that we keep in healthcare that is much higher than for general public commercial use cases. So keeping all these in mind, we can think it should be something that I would also recommend. Thank you.
Different perspective you have given to all. A special kind of a scientist from Bangalore. I request Dr. Sujoy Kalsa, Chief Medical Information Officer and the Vice President of Apollo Hospital. Well, sir, in what way can AI-based tools support the task shifting, enabling our nurses and marketers and mid-level providers to give higher quality care? Because the care is being provided, quality is getting enrobed into it slowly with quad certification, state level certifications, more of monitoring. But how to transform it to higher quality care?
Thank you. Namaskar. बहुत ठंड है, so I spice it up. And the reason why I spice it up is because I'll take it from Professor at ISC, and he asked how many startups are there, how many engineers are there. I'll start up by asking how many ASHA workers are there, and how many people who supervise ASHA workers are here. The question that we need to ask, of course, I'm not talking about people who are at least 4 levels up and looking at supervising ASHA worker. I'm talking about immediate supervisor. And why they need to be here in the room is because of the fact that whatever we heard about the capability of AI, and I go around the world, work with several universities with more than 50 research, 20 AI APIs that are now being circulated across the world, including Latin America, Southeast Asia, Australia, I could name any country that we are providing. So the question is not about that India doesn't have good data. India has. And the other, particularly clinical data. And models are now being built in India that are being used or made in India and are used across the world. So those are practically going to be hygiene. I want to give you an example here from China, 2019, 20 days before the COVID outbreak. I was in Beijing
working for World Economic Forum. And there was a speech made by the chief data officer of Chinese government. 2019, before COVID, they had the data around just X-ray data of 50% of Chinese population in the repository that they made through Philips and Tencent. So we would have to understand that people across the world are moving leaps and bounds with the collection of data, building AI tools, and taking it to public health. Now, coming back to the ASHA workers, I always answer these questions when I teach my students. In fact, yesterday I was doing that in IIM Calcutta. We talked about four very important perspectives around this. One is the capability. And the capability is not just about how you bring cloud computing, how you build softwares, how do you build those APIs. In fact, if you go and ask your workers at this point of time and ask the kind of tools they are overwhelmed by tools at this point of time. What is the kind of platforms that you are bringing in where they say that you use the most appropriate tool at that point of time? And you know what? When you build technology and get it at that point of time, they talk about the pani se adu or yini chalega cholbena. They're saying this across the country that these tools are not going to work. So having them inside the room when you design this tool is a very important perspective that we need to do. That's number one. Number two, we talk about a lot around the compute. How do you make those compute take to the last mile? And I work with Microsoft, I work very closely with GCP, and now beginning to do with AWS as well. The question then to the big tech is this, that how do you enable those compute power at the last mile? And then you work with the cognitive things. I mean, what are we expecting our ASHA or A&M workers to do? Have we scoped it? Have we skilled it? Have we put in a competency map for them to say that they are able to use this? One of the other things that comes in very naturally to this is to use tools like ambient listening. Have we looked at those kind of ambient listening with translation abilities to see that it is an ease of use for them? Because other background tools always work, whether it is, you are summarizing descriptions or making recommendations and clinical decision support. And I have a view on clinical decision support because everything is not right about clinical decision support in that. So look at this, capability, compute, the cognition of the individual who is using it, because the success from a healthcare perspective will only come if you are able to take the compute and cognition together to deliver it. And the last one is the collaboration. And the collaboration is internal collaboration, external collaboration, and collaboration to look at it from what impact it brings. Today, we build certain tools for CKD, CVD, chronic liver disease, which is now getting embedded in Siemens machines. What we found out is that for the millions of people who have used this prospectively, there are gains that people are getting into all of these by looking at it from admissions from the others. So yes, it is powerful, it is impactful, it is working. But how do you collaborate it to take it to people, to different countries across the world, and how do you go about in doing that? Lastly, I wanted to add by saying, if there is a requirement around skilling of these people, that's where, institutions like Apollo can come in, help the people who would like to, skill them up, understand what is required as per their scoping, and get all of this done. So my understanding, to summarize, is that we need to provide people with the right tool for the right time and to ensure that it brings it back over the period of time. Thank you.
God, well taken. So I take it forward to Colonel Samir Kamarji, Director Digital Health and AI Park. So it's an extension of the same question. How can we ensure that the frontline workers, especially the rural and remote areas, are adequately trained and confident, making them confident in using AI in these systems? So requirement is sure, but how can we do it? That's the next thing.
Thanks for the question, ma'am. And I'll continue the tradition which has been established in the panel. I'll ask the audience the first question. How many of you have heard about ChatGPT? Fantastic. How many are using ChatGPT? Fantastic. How many of you are professionally using ChatGPT? Fantastic. Did anybody come and teach you ChatGPT? Anyone? How did you learn? It was filling a gap which you had, right? It was intuitive. There was no teaching which was required. There was no tutorials which were required. And even if they were required, you were more than willing to invest that amount of money and effort to learn it, right? Because it was solving a problem for you, right? And that's exactly the way we need to handle the health workforce, right? I have worked extensively with Anganwadis as well as with Ashas. I have never found a problem in terms of skilling or in terms of intent or in terms of being able to learn and pick up technology, which includes UP, by the way. So this is where I actually started learning about public health just about 4 years back, right, when I left the UP. So I've learned quite a bit from this state and done quite a few of those things which I think the state is extremely proud of today in terms of delivering on digital health. Now, I think there are three issues which I want to address. And to answer your questions, in one line, there is no skilling which is required. Because if skilling is required, then probably we are using and developing the tools the wrong way. And ma'am, you answered, you made a very pertinent statement in your opening remarks, and I noted it down actually, was that AI needs to be an invisible enabler and not a visible, uh, you said, burden. Right? Fantastic. Now that's been the story for digital health as is in public health, right? Because our systems are not designed like what Joy mentioned by keeping, what we call known as the human-centered design, keeping the person for whom it is being designed in the center and design it according to their requirements. Solve their problems, make that tool a job aid for them. They should be jumping and picking up their smartphone because they know it's going to solve my life. It is going to solve my professional problems, right? Nobody came to us to teach us Paytm. Did anybody come and teach us Paytm or a UPI? Everybody in this country today is using that system. If you just go back to a report, of the digital journey in India, 2008 we were the most unbanked country in the world. 2019 we were the most banked country in the world. 9 years. And the report says it would have taken India 47 years had it not done what it had done in the space of DPIs to do what they did in 9 years. Right? We do the maximum number of digital transactions today in the world. We have the cheapest internet. We have 1 billion smartphones. 80% of Indian families have a smartphone at least. Right. So we have everything in place. We have everything in place. The issue is, are we designing the applications for the person who's going to use them? A, right. Are we trusting that person to be able to use that technology and not making it a monitoring tool, right? Unfortunately, all our digital systems are based on data entry, data capture. The data is never used by anyone in the system, right? So the data which is being captured needs to be used by the person who's capturing the data. If it is of no use to the person who's capturing, is never going to capture it the way you want it to be captured, right? So the system design is extremely, extremely important. The second most important aspect is the mindset change. Right? The entire mindset, human mindset, when we work in the public health space, needs to change to be able to adopt technology. It is not a monitoring tool. It is a job aid. It is meant to help you perform your job better. It should not be used by the supervisory staff for monitoring the person who is actually capturing the data. That's where we go wrong, right? And that's why the reason people do not adopt technology. Right? They are scared of it. They will throw it out. Oh shit, I am going to get monitored. My attendance is going to be taken. Somebody is going to question me. So I think there has to be a mindset change for people to be able to adopt this technology. We have adopted the technology. We have enough number of examples in other sectors, right, of adoption of technology, and it has been adopted just primarily because we were able to position that technology at that junction, which was actually solving a problem for that individual. And the last point I want to make is that AI is fashionable today. Are you using AI? If you're not using AI, probably you are outdated. I think what we need to do at the planning stage is to align what is that problem which we want to solve, and does AI have the capability to be able to solve that problem or not, rather than just trying to push technology down to that end user, right? To say, oh, I have an AI, start using AI. No, because we've been told to use AI. We are on the AI mission. right? We have an India AI mission and we are on a mission, and therefore we need to use AI. That's now how it needs to be pushed down. It needs to be pushed down to solve a problem for that person for whom you develop that technology. And unless and until that happens, we will keep having these debates year over year. And probably, health sector, unfortunately, is the last sector in this country which has actually picked up technology. Unfortunately, whatever we learned in COVID, unfortunately, we unlearned that very quickly and went back to the same system which we were using before COVID. I think unless and until we change the policy mindset, we change the mindset of the supervisory staff, of the mid-level leadership, of the higher level leadership to be able to absorb and push technology in a manner which is positive in nature for the end user, we will not be able to solve this problem which we are wanting to in terms of doing courses and skill development. It does not require any skill development, right? You use your TV remote, it is equally complex and probably more complex than using AI. We are still using it because we want to use. So I think unless and until we go into that space, we will not be able to solve this problem.
I have a rebuttal. I have a rebuttal, and I'll say, I agree to most of the things that he said. But one thing that we have to look at, particularly in the account of medical decision support, and if you go back and look at, because I believe that most of you are clinician and you have access to Lancet, look at the Lancet's um, gastroenterology journal in October 2025. It says that overuse of AI is de-skilling healthcare workers. And if it begins to de-skill, that's a separate problem that we're now going to have, particularly in hands of, the tools in the hands of our ASHA workers or ALM workers in that way. So those designs are very important, how you bring it into healthcare force, particularly with the use of AI.
Thank you, Dr. Roy. Shortage of time, and then another panel has to start. We just have a very quick round of one small short question. Quick reply is expected. So, Professor R.K. Singh ji, how do you think that the follow-up care, the most important of all follow-up in the AI can be helpful?
Thank you for the question. Follow-up for geriatric patients, follow-up for our routine patients, follow-up for with the help of remote patient wearable devices is the way forward and it's going to come very big way. Follow-up through telemedicine technology, follow-up through virtual ICUs, chatbots, through Autobots. So these is all going to come in a big. I will again ask a big raise of hands of all the doctors who are present in the audience. Just one more time. All doctors, a lot of them. So I talk to you. You are overburdened. Your work because of 70% of the time you are documenting something. So documentation is your majority workload. Rather than your expertise being used for clinical care, you're actually documenting. So AI is an enabler, can help you reduce that documentation. I've got 100 patients to be covered in 1 hour. I have practically less than a minute for a patient. Of that 70% time I'm documenting, so what is the amount of time I'm actually seeing the patient? 10 seconds, 15 seconds, 30 seconds. So my documentation workload must come down with AI. So for all those who are sitting with us, if you can enable our EHRs with reduction of my documentation, because EHR is making me a data entry operator. You have made me a typist. So enable me through NLP multi-language platforms that I don't have to document and again. So EHRs have to be enabled with this technology. This is for all the doctors who are working there and who will be flooded with AI tools in the coming times.
Okay. So one more last question. Last question, sir. Arvind Kumarji, sir. How can the startups and the innovators can align their AI solutions with on-ground public health realities rather than just creating policies? Because India has come up with expectations of the world having the startups and the new technologies in-house in.
Thank you. So, Samiraj asked how many people use the Chat GPT. I asked on Chat GPT how many people are using for health-related problems. So it says, as per the some report of OpenAI, which is AI as a health ally, it says 20 million people are using on daily basis Chat GPT for their health-related problems. So just putting the numbers in the proper perspective. As far as the startup is concerned, we have more than 1.7 lakh startup in this country. More than 10,000 startups are working in the health domain. But what I have seen is that I have a couple of health tech startups, center of entrepreneurship, including IT Kanpur. We also run one called MedTech, then IT Jodhpur. And I found there are many startups which is working in the very common area. Well, the problem statement is the same, and many of the cases solution is also the same. So there are many silos between startups. Out of 10,000, if you say what kind of how many number of the problems they are solving, they may be solving maybe not more than 3,000 problem. But there could be 3 million of the problem which could require to be solved. So I think there is a need to create a very large ecosystem of startups in this country. For health tech itself, uh, I don't impress, but when somebody says this startup has created some flying car, I'm only impressed when somebody says that startup has created something by which you can detect cancer early, you can solve some personalized problem of old age people, if you can reduce the drug discovery cycle. So these are the some basic problems which required to be solved by our startups. I think corporate and government should come together to help those startups. Uh, those can solve pressing problem of the country, especially focusing on our country. So thank you very much.
Thank you. So we would request somebody maybe from the audience side, they have quick one or two questions because there's paucity of time because of the session. Ah, next, please. Fast.
Good morning to all. Sir, my name is Uday Kumar Sharma. I am from SIPSA. Sir, I have two very small questions. Sir, first, how can we develop AI in-house capabilities in analyzing the current data which is available to us? And second, sir, that as many health data is available in many different websites, is there any time to come to develop a general API to access this data? Because today we are living in a data-driven world.
Sure. So this is a question, if I understand the question right, about the use of the current data resources that are available. So we ourselves are in the Transition AI Healthcare Center. We are trying to work with the NHA to unlock a lot of the data that is already there. But some of the key challenges I will try to highlight is many of these protocols have not been designed with an AI first thought. Like, we want a particular standardized way of formatting and getting data in. There are lots of missing pieces of data. So some of these particular parameters were not measured for some reason. So now you have a lot more complex modeling process that has to come in to take care of the data, to look over what has not been recorded, still come up with the decisions or the responses the doctors would have made for those patients. So yes, it is challenging, but there is a lot of opportunity also here that current modeling techniques can use some amount of missing data to take care of.
Thank you.
Can I add them just the government of India has an initiative known as e-Kosh, which has been established, which is primarily meant at setting up databases for different sectors. So it's work in progress, and they intend opening up the APIs also for startups to be able to use that going forward. So it's a GPU being set up, it is e-Kosh being set up, and then giving access to data as well as GPUs. That's the plan.
So,
Uh, Thank you very much. This is Ajay Singh. I'm the Vice Chancellor of Survey Medical University. It's not a question, it's an observation from my side that when we are discussing the AI and the healthcare, and we should focus on the adoption of how efficiently it will be adopted. And unless until we will not discuss the registry formation, means how many, not only about the types of diseases, but spectrum of the symptoms which are prevalent, because the description of symptom in our area is quite different from other areas. So spectrum of symptoms should also be integrated as far as when the AI we are talking. And as a policymaker, I think you must give emphasis on this aspect when we are discussing about the AI in future. Thank you.
Thank you. Last question. Madhuri ma'am, one lady. पीछे, जया पीछे. हाँ. At least one woman has to be represented.
Good morning, ma'am, and good morning to all the dignitaries on the dais. First and foremost, we would like to thank all of you for enlightening about all the advantages. So, as very rightly said, ChatGPT has helped us in many a thing. But this is also just an observation, me being a medical college teacher for many students, that we need to align ourselves and we also need to train the students to get enlightened and also have academic and cognitive knowledge, try to be totally dependent on the AI tools, because sometimes, as every rose has its thorns, they also have some of their shortcomings, which we need to align with our knowledge. And as said, the human guidance is always needed before we let them fall into the hands of those who are not well trained. Thank you so much, ma'am.
पीछे एक है, मैडम है, मैम जया उधर रेड सॉरी. पहले हाथ पर रखिए. हाँ हाँ उनको.
Thank you so much. I am Dr. Madhvi Devraj. I work for the University of Manitoba and UPTSU. Sir, this question is to you, sir, Dr. K.P. Singh. Studies have shown that the postpartum depression in UP is roughly about 14%. Right, sir? A, the women do not even know they are suffering from postpartum depression. And second, you have actually mentioned that through the facial expressions, you can identify the woman suffers from mental health issues or not. But the thing is, even if they know they are suffering from such a situation, they do not want to go to the psychiatrist. So it's actually a behavioral problem. So what is your opinion on how AI could be useful in changing the behavior?
This is the smartphone can help you decipher whether somebody is in having a depression by facial recognition, by behavioral recognition, by speech recognition. It can identify if a person is having suicide ideations, if it's having a depression, it can identify that much. Now, the family member is a part of the entire cascade when somebody is using it. So it is the onus will definitely lie with one of the family members, the husband persons. So he has to take in a call with either a telepsychiatry with an AI-enabled feature. So there has to be support within the system. Somebody is getting pregnant, getting postpartum depression. The family doesn't know this disconnect is not acceptable. So the family, the husband, somebody has to take onus for taking the consultations to that. Even if the patient is not doing it, the family member has to take the onus to go to a psychiatrist or consult a psychiatrist for taking adequate help. I can just say this much. AI can help you decipher something. AI can help you give us some sort of a prescription which needs to be vetted by a psychiatrist through a telepsychiatric consultation platform or through telepsychiatry plus AI-enabled platforms. So this much AI can help you. But physically, you will at least still have to go to a psychiatrist, the help of your husband, to that center to get the help around.
Thank you, Mr. Kissing. So I thank all the panelists and formally Eugene will do that. Dr. Sujoy, I just wanted to add what you told that any Asha here. So we have an officer who monitors them here. We have got, and there is a YouTube link created yesterday on and has been circulated to all the districts till down where all the conversations are being saved, stored, and they can be watched later also. Thank you.
Thank you to our panelist and the moderator for sharing not just your expertise, but also your experience. Your contribution has enriched this forum. And as a token of our appreciation and gratitude, I'd like moderator to present mementos to our panelists. Ma'am. Professor Sri Ram Ganpati, we'll start with. Professor R.K. Singh. Shri Arvind Kumar. Dr. Sanjay Sood. Colonel Sameer Kanwar. Dr. Sujoy Kar. And it is my pleasure to present the memento to Dr. Pinky Joel. Thank you, everyone. Can we please come together for a group photograph? We'll break for tea now. The tea is being served on either side of the hall in the lawn. चाय की व्यवस्था इस हॉल के दोनों तरफ लॉन में है. प्लीज आप लोग एंड आप लोगों से अनुरोध है कि आप लोग चाय लेके जल्दी आ जाएं. एंड बिकॉज आफ्टर दिस टी ब्रेक वी विल हैव अ प्रेजेंटेशन बाय Mr. Brijesh Kumar Singh, Business Head Imaging, ISC Zone, Philips Digital Imaging. Just grab your tea and come back for the presentation by Philips Digital Imaging.
माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के विजन से शुरू हो रही है एक नेशन वाइड मूवमेंट जहां एआई सीखेगा हर भारत।
हमारे लिए AI सिर्फ एक टेक्नोलॉजी नहीं है, बल्कि भारत के युवाओं के लिए अवसरों का एक नया
All right, ladies and gentlemen, just wanted to announce and request you all to please go and have your tea and coffee. And I request you all to please get back after 15 minutes so that we can start with our next panel, where we have the esteemed dignitaries who will be joining us for the second panel discussion for today's event. So I request each one of you to please get back after 15 minutes. देखिए सज्जनों, आप सभी से निवेदन करना चाहूँगी कि टी एंड कॉफ़ी ब्रेक के बाद 15 मिनट के बाद हम वापस से इस कार्यक्रम की शुरुआत करेंगे और हम हमारे अगले पैनल डिस्कशन की शुरुआत करेंगे। मैं यहाँ उपस्थित सभी अतिथिगण से निवेदन करना चाहूँगी कि अगले 15 मिनट में वापस से इस कार्यक्रम में हमें हमारे साथ जुड़े। धन्यवाद। All right, ladies and gentlemen, this is a special announcement for all these esteemed speakers out here that for the speakers, we have arranged the tea and coffee at the Optimum Hall. It's downstairs nearby the reception at the registration area. So I request all the speakers to join us there, tea and coffee. देवियों सज्जनों यहाँ उपस्थित हमारे स्पीकर्स को मैं सूचित करना चाहूँगी कि सारे स्पीकर्स के लिए हमने टी और कॉफ़ी का इंतज़ाम ऑप्टिमम हॉल में किया है। मैं रिक्वेस्ट करूँगी यहाँ उपस्थित सभी स्पीकर्स को कि हमें ज्वाइन करें ऑप्टिमम हॉल में। धन्यवाद। Ground floor, I request all the speakers to join us to the ground floor for the tea and coffee. This is a special announcement for all the esteemed speakers out here. Thank you.
कौन सोच सकता था कैश के बिना पेमेंट हो जाएगा? कौन सोच सकता था एक टैप में पूरी दुनिया हाथ में आ जाएगी? इंडिया ने ये कर दिया और अब नेक्स्ट बिग लीप एआई। पर एक सवाल है, एआई सिर्फ एक्सपर्ट्स के लिए, सिर्फ कोडर्स के लिए? बिल्कुल। माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के विजन से शुरू हो रही है एक नेशन वाइड मूवमेंट जहां एआई सीखेगा हर भारतीय।
हमारे लिए AI सिर्फ एक टेक्नोलॉजी नहीं है, बल्कि भारत के युवाओं के लिए अवसरों का एक नया द्वार। भारत ने इंडिया AI मिशन शुरू किया। भारत हर सेक्टर में AI का उपयोग बढ़ा रहा है। हम दुनिया को भी बेहतर AI सॉल्यूशन देने में जुटे हैं।
बच्चे, युवा, प्रोफेशनल, हर शहर, हर गांव। इस मिशन का पहला स्टेप है युवा एआई फॉर ऑल। सिर्फ 4 घंटे का कोर्स, सिंपल, प्रैक्टिकल, पावरफुल। सीखिए एआई क्या है, कैसे काम करता है और कैसे एआई को रिस्पॉन्सिबली यूज करके अपनी पढ़ाई, काम और आइडियाज को नेक्स्ट लेवल ले जा सकते हैं। सब कुछ बिल्कुल घर बैठे। कोर्स कंप्लीट करें और पाएं गवर्नमेंट ऑफ इंडिया का सर्टिफिकेट। लाखों इंडियंस को एआई रेडी बनाने का काम। हाँ, इस फ्यूचर का हिस्सा बनना ऑप्शनल नहीं, इस फ्यूचर को शेप करना अब आपके हाथ में है। अभी एनरोल करें युवा एआई फॉर ऑल फ्यूचर स्किल्स प्राइम.इन क्यूआर कोड स्कैन करें और एआई के साथ विकसित भारत के सपने में सीखिए, सोचिए, बनाइए एआई के साथ। जय हिंद। कौन सोच सकता था कैश के बिना पेमेंट हो जाएगा? कौन सोच सकता था एक टैप में पूरी दुनिया हाथ में आ जाएगी? इंडिया ने ये कर दिया और अब एआई सिर्फ एक्सपर्ट्स के लिए, सिर्फ कोडर्स के लिए? बिल्कुल। माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के विजन से शुरू हो रही है एक नेशन वाइड मूवमेंट जहां एआई सीखेगा हर भारतीय।
हमारे लिए एआई सिर्फ एक टेक्नोलॉजी नहीं है, बल्कि भारत के युवाओं के लिए अवसरों का एक नया विभाग। भारत में इंडिया एआई मिशन शुरू किया। भारत हर सेक्टर में एआई का उपयोग बढ़ा रहा है। हम दुनिया को भी बेहतर एआई सॉल्यूशन देने में जुटे हैं।
बच्चे, युवा, प्रोफेशनल, हर शहर, हर गांव। इस मिशन का पहला स्टेप है युवा एआई फॉर ऑल। सिर्फ 4 घंटे का कोर्स, सिंपल, प्रैक्टिकल, पावर। सीखिए एआई क्या है, कैसे काम करता है और कैसे एआई को रिस्पॉन्सिबली यूज करके अपनी पढ़ाई, काम और आइडियाज को नेक्स्ट लेवल ले जा सकते। सब कुछ बिल्कुल फ्री, घर बैठे। कोर्स कंप्लीट करें और पाएं गवर्नमेंट ऑफ इंडिया का सर्टिफिकेट। लाखों इंडियंस को एआई रेडी बनाने का टारगेट है। हाँ, इस फ्यूचर का हिस्सा बनना ऑप्शनल नहीं है। इस फ्यूचर को शेप करना अब आपके हाथ में है। अभी एनरोल करें युवा एआई फॉर ऑल फ्यूचर स्किल्स प्राइम.इन क्यूआर कोड स्कैन और एआई के साथ विकसित भारत के सफर में सीखिए, सोचिए, बनाइए एआई के साथ। जय हिंद। कौन सोच सकता था कैश के बिना पेमेंट हो जाएगा? कौन सोच सकता था एक टैप में पूरी दुनिया हाथ में आ जाएगी? इंडिया ने ये कर दिया। अब नेक्स्ट बिग इशू एआई। हर एक सवाल एआई सिर्फ एक्सपर्ट्स के लिए, सिर्फ कोडर्स के लिए? बिल्कुल। माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के विजन से शुरू हो रही है एक नेशन वाइड मूवमेंट जहां एआई सीखेगा हर भारतीय।
हमारे लिए एआई सिर्फ एक टेक्नोलॉजी नहीं है, बल्कि भारत के युवाओं के लिए अवसरों का एक नया विभाग। भारत में इंडिया एआई मिशन शुरू किया। भारत हर सेक्टर में एआई का उपयोग बढ़ा रहा है। हम दुनिया को भी बेहतर एआई सॉल्यूशन देने में जुटे हैं।
बच्चे, युवा, प्रोफेशनल, हर शहर, हर गांव। इस मिशन का पहला स्टेप है युवा एआई फॉर ऑल। सिर्फ 4 घंटे का कोर्स, सिंपल, प्रैक्टिकल, पावर। सीखिए एआई क्या है, कैसे काम करता है और कैसे एआई को रिस्पॉन्सिबली यूज करके अपनी पढ़ाई, काम और आइडियाज को नेक्स्ट लेवल ले जा सकते। सब कुछ बिल्कुल फ्री, घर बैठे। कोर्स कंप्लीट करें और पाएं गवर्नमेंट ऑफ इंडिया का सर्टिफिकेट। लाखों इंडियंस को एआई रेडी बनाने का टारगेट है। हाँ, इस फ्यूचर का हिस्सा बनना ऑप्शनल नहीं है। इस फ्यूचर को शेप करना अब आपके हाथ में है। अभी एनरोल करें युवा एआई फॉर ऑल फ्यूचर स्किल्स प्राइम.इन क्यूआर कोड स्कैन और एआई के साथ विकसित भारत के सफर में जुड़ जाए। सीखिए, सोचिए, बनाइए। कौन सोच सकता था कैश के बिना पेमेंट हो जाएगा? कौन सोच सकता था एक टैप में पूरी दुनिया हाथ में आ जाएगी? इंडिया ने ये कर दिया है। अब नेक्स्ट बिग इशू एआई। हर एक सवाल एआई सिर्फ एक्सपर्ट्स के लिए, सिर्फ कोडर्स के लिए? बिल्कुल। माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के विजन से शुरू हो रही है एक नेशन जहां एआई सीखेगा हर भारतीय।
हमारे लिए एआई सिर्फ एक टेक्नोलॉजी नहीं है, बल्कि भारत के युवाओं के इंडिया एआई मिशन शुरू किया। भारत हर सेक्टर में एआई
फोटो खींच देना एक दो, जो फिर हम लोग बाद में वो पीआईसी का ये बोल रही है, उसके लिए बोल रहा हूँ। तो पीआईसी का कम्युनिकेशन को बोल दिया उसने, तो हमें कुछ 2-3 अच्छे फोटो डालने होंगे, क्योंकि उसने कम्युनिकेशन टीम को बोल दिया है एक क्रिएट करने के लिए, वो आपका योगी वाला ही भेज देना है। यूपी इंडिया का मोस्ट पॉपुलर स्टेट है, राइट? सर बॉम्बे के आसपास होगा, वो 4-5 करोड़ होगा। हाँ तो मतलब बॉम्बे के आसपास होगा ना।
healthcare हो, education हो,
6.1 बिलियन।
भारत हर क्षेत्र में
हाँ
AI का उपयोग बढ़ा रहा है।
60 लाख। मुंबई है 2 करोड़।
अगर उत्तर प्रदेश की मैं बात करता हूँ, पिछले 8-8.5 वर्ष में हम लोगों ने उत्तर प्रदेश में 42 नए मेडिकल कॉलेजेस बनाए, 2 एम्स बने हैं, जो सफलतापूर्वक संचालित हैं। उत्तर प्रदेश के तमाम नए संस्थान उत्तर प्रदेश में इस दौरान स्थापित हुए हैं, जिसके माध्यम से उत्तर प्रदेश के 26 करोड़ से अधिक नागरिकों को बेहतरीन स्वास्थ्य सुविधाएं उपलब्ध हो चुकी हैं। जो कौन सोच सकता था कैश के बिना पेमेंट हो जाएगा? कौन सोच सकता था एक टैप में पूरी दुनिया हाथ में आ जाएगी? इंडिया ने ये
अब वो लगा देते हैं ना, अब स्क्रीन लगा दें।
पर एक सवाल, एआई सिर्फ एक्सपर्ट्स के लिए, सिर्फ यूजर्स के लिए?
और जब ऊपर जाऊंगा तो अभी आप ऑन कर दोगे, मेरी तरफ से ऑन है, आपको ऑन कर। स्टार्ट डाउन।